episode 27 of the Athlete's First Performance podcast. Today, I'm breaking down 3 ways I'm looking to improve outcomes in 2025. The 3 ways I'm looking to improve outcomes in 2025 are improving the use of diagnostic ultrasound, implementing mechanical diagnosis and therapy, otherwise known as the McKenzie method, and improving my skills with handheld dynamometry and force testing. Let's start with diagnostic ultrasound. Diagnostic ultrasound is a great way to accurately and rapidly improve your decision making when it comes to musculoskeletal diagnosis and treatment. It is a lot more inexpensive compared to MRI and more advanced imaging techniques, and it allows us to provide a dynamic assessment for joints such as the shoulder, ankle, and knee compared to more static testing such as x-rays and MRIs. And what are some indications for diagnostic ultrasound? It's great for looking at joint effusion, long bones, especially fractures of the distal extremities, such as the metacarpals and metatarsals, muscle injuries, such as hamstring, gastroc, or bicep strain, tendon pathology, such as rotator cuff tears or tendinopathy. It's also great for assessing ligamentous structures, such as the collateral ligaments of the knee, elbow, as well as around the ankle joint. It can be used to assess and diagnose for myeloneuropathies, such as median and ulnar nerve neuropathy, as well as assessing for a ganglion cyst and bursitis. I don't think diagnostic ultrasound is going to take place of a physical therapy exam in terms of the subjective and objective assessment, but I think it's going to improve our clinical decision making when it comes to ordering advanced imaging, especially in the military setting where physical therapists and athletic trainers have the ability to order such imaging. I also think it's going to help us with prognosis, such as grading specific muscle strains and ligamentous sprains. And it could also provide the patient a lot more comfort knowing that their specific injury was assessed outside of just a physical exam. Next, we'll talk about mechanical diagnosis and therapy, MDT, otherwise known as McKenzie. So the Army is making a big push and taking initiative to train a lot of physical therapists throughout the force to improve the systematic evaluation and treatment of MSK injuries. So if you looked at the research throughout the Army, MSK injuries are the leading cause for missed time and appointments throughout the military. Being able to utilize MDT facilitates a common language for MSK diagnosis and treatment. MDT is also an easy way to triage patients and assess for rapid responders. In the military, there are certain brigades and physical therapists that are combining the top tier SFMA with MDT assessment and treatment for rapid responders. And using this algorithm, they're teaching combat medics and 68 Foxes, which is the Army term for physical therapy techs, a treatment algorithm using MDT for effective patient recovery. Next, let's talk about the MSK imperative. So how does MDT fit into military medicine? There's a great paper out called the musculoskeletal imperative, which I'll link in the show notes, that goes over the assessment and treatment using MDT and providing an algorithm for soldiers, providers, such as physical therapists, medics, and so on, to be able to assess and treat for rapid responders. So let's talk about using MDT in the big scheme of Army medicine and physical therapy. So this is from a great paper called the Musculoskeletal Imperative, written by 3 physical therapists in the Army to better maximize return to duty outcomes and combining a common language for musculoskeletal diagnosis and treatment. So here's a great quote from the paper stating medical personnel need to identify return to duty patients as early in the evacuation chain as possible. So they're talking about in a deployed environment, we need to be able to assess and rapidly identify who's able to stay in the area of operation and who needs to be evacuated due to poor prognosis. And the goal of medical efforts in the regeneration site is to maximize return to duty. So as musculoskeletal providers, we need to be able to rapidly assess and treat these patients to determine their availability for their job, especially in deployed environments. They also go on to talk about the musculoskeletal injury management, and they demand a level of standardization for MSK specialists and experts. So they talk about in different doctrine, combat medics and emergency medicine, they have specific standardized algorithms to be able to treat and assess patients rapidly using a specific algorithm. And in the MSK world, there's no specific algorithm and return to duty decision process in Army doctrine so far. So their proposal in this paper was using MDT to provide a standardized mechanical assessment. And for those that are not familiar with MDT or McKenzie, this method uses repeated joint and spinal movements as well as sustained positions to clarify the clinical picture and accurately classify a musculoskeletal injury or pain complaint. And there's currently several high-level MDT clinicians throughout the Army. And in the paper, they note the Ranger Regiment and the 173rd Airborne that are using MDT to rapidly assess and return to duty specific patients that meet the standards of MDT. Now, I'm currently in the process of being trained in a small cohort of PTs throughout the country that are going through all the MDT classes. So far, I've gone through Part A and Part B, which include the lumbar spine in Part A and the cervical spine and thoracic spine in Part B. And I was a little bit skeptical at the beginning before taking the course, but so far I'm about halfway done through the certification, and I found a great improvement in my ability to improve low back pain and cervical spine pain quickly in specific cases, especially with the rapid responders. So in the paper, how do they determine MSK classification? The patients and the soldiers that fit the MDT classification derangement are called green flag conditions. And these are conditions that resolve quickly and allow the soldier to return to duty without significant time loss. And from their assessment and research so far, these green flag conditions are present in over 70% of all people who report some type of spinal pain, including neck, thoracic spine, or lower back. The next category is structurally compromised. These are more traumatic injuries such as shoulder dislocation, ACL tear, things of that nature that won't be rapid responders using MDT. They also use the term recovering trauma. And in this case, they're using the example of a sprain or a strain. So not as significant as a shoulder dislocation or ACL tear, but maybe think about something like a hamstring injury or a lateral ankle sprain that's not significant enough to be classified as structurally compromised. The next term is joint or muscle dysfunction. So in MDT, they use the term derangement and dysfunction. And dysfunction can include tissue abnormalities that require remodeling through specific exercise in the MDT model. And the last case is other or non-MSK disease processes. So we still have to be able to clear red flags and understand mechanical symptoms. And if the patient is not presenting with mechanical symptoms, we need to be able to move them to a higher level of care to determine what specific disease process is going on if it's not MSK. And the big thing with this classification process is having a specific prognosis and course of treatment geared towards that assessment and prognosis. So to end with, we'll talk about joint PMCS. PMCS stands for Preventative Maintenance Checks and Services. And PMCS takes place on military equipment and vehicles, so we need to be able to teach our soldiers how to perform PMCS on themselves. Joint PMCS has been incorporated into official doctrine underneath the H2F drills and exercises, ATP 7-22. And what this is, it's a way for soldiers, medics, and providers to identify the presence of a green flag condition through a standardized mechanical assessment. Joint PMCS takes the most common movements in MDT, and there's an algorithmic approach to be able to treat themselves in terms of pain or lack of range of motion. So the last category that I'm looking to do is dial in force testing. So as physical therapists and sports medicine professionals, we understand that manual muscle testing is insufficient to assess muscle capacity. And being able to use devices such as the Tyndek, peak force dynamometers, or even force plates is a great way to objectively assess muscle and joint function during the rehab process. I think handheld dynamometry and muscle force testing is a great way to establish age and sport-related norms and strength to body weight ratios. So there's more and more research coming out, especially with injuries such as ACL reconstruction, to determine where a patient should be at different aspects of their rehab. So that goes into the next category of standardize a criterion-based rehab goal for return to duty and return to play. So being able to specifically assess the injured joint to determine where they're at compared to their peers and the age-related norms helps us check our work to make sure that we're actually prescribing the right amount of strength, plyometrics, and so on to make the changes that we're looking for. And last, muscle force testing can be used as a screening process to detect risk factors for injury. Like we already talked about, there's specific age and sport-related norms for specific joints. And to be able to assess athletes compared to their peers and age-related norms is a great way to help inform specific programming and strength conditioning principles that we need to get them up to speed compared to their peers with the hopes of mitigating risk of injury. So this is just a brief overview, what I'm looking for in 2025, and I'd love to hear your thoughts and opinions on diagnostic ultrasound, MDT, and muscle force testing. I'll be sure to link all of my resources in the show notes. And if you have any questions, comments, concerns, please feel free to reach out. You can reach out on Instagram at Athletes First Physio, which I'll also link in the show notes. If you like this information, please follow and subscribe to the podcast and make sure to let me know if there's anything else that you're interested in hearing about.